for the breastfeeding. We have knowledge, but we are lacking in the practices of the breastfeeding. If you see the overall prevalence of the getting the exclusive breastfeeding for first 6 months in India, it's our traditional practices. Still, we are unable to cross the 40 percentage. So it means the 60% babies are away from the exclusive breastfeeding, which is alarming sign for us. So it's really very important. Having a knowledge is good, but it's supposed to be converted into the practices is very, very important. Okay, so it's a global and national recommendations for the breastfeeding that we have to provide the exclusive breastfeeding for first 6 months of baby's life, and after completion of the 6 months we can introduce the complementary feeding based on the basic principles of that. Okay, and minimum you have to breastfeed a baby minimum 2 years and maximum 5 years. These guidelines are given by the infant young child feeding practices, IYCF. Okay, the 5 years we never think on this, but it is scientifically proven till the age of 5 years the mother can able to breastfeed a baby. Minimum 2 years, maximum 5 years, and exclusive is for 6 months. So, what are the benefits of the breastfeeding? Just we will go in, and after that, I will just trying to correlate the physiological characteristics of that breast milk, how it is correlating with the benefits. So, it is a complete food for the baby, and we can say it's a perfect, robust nutrition for a baby, which for the preterm baby, 100% the you have to give the milk of the same mother. Okay, if the baby is using the milk bank and these all things, you will try to identify the milk of premature delivered mother, because that is a perfect nutrition for the full term baby. Definitely the full term mother's milk is 100% for them. The same baby same milk we are expecting, that is our basic goal. But still, if you are not able to get, if you are searching for the different resources like a human milk bank, definitely you have to just try for that. Then its benefit includes the higher intelligent quotient. The babies who are taking the breastfeeding, definitely their IQ level is high. Then emotional bonding between the mother and baby, between the family members, between the society is proven that they have a good bond with the society. Then it prevents the infection. As you know, the immune system is developing in the age of during the first year of life only, and the baby is getting so many nutrients through the breast milk, which the baby can protect himself from the different types of infection, which can become a reason for the comorbidity for the baby. Then it prevents the chronic disease. Definitely, the asthma and diabetic like disease conditions we are able to prevent with the help of breast milk, and it is easily digested milk for the baby. Then benefits for the mother, it reduces the post-delivery bleeding. As you know, the oxytocin, prolactin, reflexes, and these all things, as well as the anemia also, and it's we can use as a it's we can say as it is declared as a natural contraceptive also, because hormones are released, that oxytocin, prolactin, which can delay the next pregnancy. And the more of the diseases like breast cancer, ovarian cancers, the mother is getting protections if she feeds her baby exclusively 6 months. Okay, even nowadays it's a passionate. During the NC period, the mother is taking a good diet. There is a weight increase. It's a bit quite natural, but so now the present generation is very conscious about weight and is all things. So this is a one we can say benefit for the young generation to lose the weight if they are breastfeeding the children. Then emotional bonding, definitely it is from the both the side, from the mother side also, from the baby side also, and it's very good that as a mother she's supposed to be involved in so many work, housework and other works. So there's from her relaxation side is what, there's no need to prepare the separate milk for the baby. Okay, and for the society, definitely it reduces if the mother is working in the any sector, then the absenteeism from the mother is very less as the baby's illness is very baby will not frequently become sick, so mother may not take the leave, which will increase the productivity of that particular uh, unit. Okay, then economically, which affects the economics of the India, and which enhances the bonding between the society and them also. And ultimately, if the productivity is increased, definitely the GDP will also increase. The social advantage for the mother, it's eco-friendly. Nowadays we are just talking about the eco-friendly things, sustainability and these all things. So breastfeeding is considered as an eco-friendly resource for the baby, which gives a healthy citizen. We know that if the baby is taking the breast milk, definitely his growth and development is uh, we can say 100%. We will not label it as 100%, 99% we can assume. And then it's a cost effective, no any separate preparation and financial is required. Only the mother health matters for the adequate and qualitative milk. Then with the help of this, we are able to generate the productive population for the citizen with the help of less comorbidity when they become young. So just we will focus on the physical health. So breastfeeding reduces the respiratory tract infection by 72%. And nowadays, if you see babies' respiratory tract is under the growth and development till the age of 8 years. If you enter in the pediatric ward, alternate bed, you are getting the patients with the bronchopneumonia, with the upper respiratory tract infection, with the lower respiratory tract infection, and so on. So if the baby is getting the breastfeeding, the 72% chance risk is less. Okay, because it contains the immunoglobulin as well as the antiviral factors, cytokinase, leukocytes, which destroy the pathogens and which will boost the immunity. With the same, the baby is also away from the ear infections by 50%. So another thing is the third important. If you see the under five morbidity and mortality, the reason is diarrhea. Yes, the prevalence of diarrhea is too much in the remote areas. If you see due to the so many unhygienic conditions and these all things. But in case of if the baby is taking adequate breastfeeding, there is a low risk of diarrhea, where we can decrease the mortality as well as morbidity. So it shows that for 64% risk is reduced due to the breastfeeding. If you see the characteristics, the breastfeeding contains the oligosaccharides, which is the third largest solid component of the human milk. And if you see, it is protecting the cell surface structure, and which block the attachment of the pathogen. So it will protect the mucosa and preventing the gastrointestinal infections to the baby. The next important is secretory IG, that is immunity against the gastrointestinal infections who have been exposed to the pathogens. If the mother is exposed to that particular pathogens, directly or indirectly, definitely the human milk contains that IG. Then the lactoferrin, which is a basic protein which destroys the pathogens and reduces the inflammatory responses and increases the activity of the immune system. It is a growth factor for the lymphocytes. You all know the benefits of the breast milk. Just I am trying to correlate with their uh, compositions and their effects. So if the justification is there, definitely our actions will become strong. So the third important one is the cognitive develop and developmental benefits. So yes, in the initial slide I just discussed the high IQ score. Yes, definitely the cognitive development is increased. It is not only the academic performance, but there is the overall development of a baby. You can able to see it's maybe a social development, language development, psychological development. As per the theory, if you see the baby is 100% fitted in that phase, which we expect as per the Sigmund Freud theory and Erikson theory. Then the enhanced brain development, particularly for the verbal and non-verbal communication. Definitely, these babies are more strong in the verbal and non-verbal communication, which promotes the brain development. This is the myelination of the CNS, cognitive scores are more. Okay, these are the even the breastfeed babies having a more adequate head circumference and brain size. With the help of MRI, these researches are done. Then these are the two important components which is found in the breast milk, that is docosahexaenic and arachidonic acid, which plays an important role in the cognitive growth and visual acuity. It is nothing but the omega 3 and omega 6 fatty acid. Okay, particularly it is a structural component of the brain and the retina of the eyes. If you see the how what is the action of these two important components on the baby's growth and development, it maintain the neural pathways, synapses, also develop the cell membranes of the brain. Then the centers like learning center, memory center, and cognitive functions become very strong, and as well as it supports the various cellular processes also. Then the emotional and psychological benefits. It reduces the risk of anxiety and depression. It works in the both ways for the mother as well as the baby. Okay, mother is getting some diversional therapies during the breastfeeding. She may interact while breastfeeding. She is interacting with the child, just observing her smiling face. Try to talk with that child. These all factors are decreasing her anxiety and depression. For the baby, definitely, if the baby's IQ is high, social component, emotional stability, emotional quotient is strong, definitely there is a less chances of anxiety and depression for the children in the future also. And we all know the mother and child bonding. Yes, when the baby is taking the breastfeeding, there are so many types of the breastfeeding: direct breastfeeding, indirect breastfeeding. We are focusing on the direct breastfeeding, which is a skin to skin contact. Indirect breastfeeding means you can take the breast milk in the vati, and you can through the vati spoon you can give the breast milk. The what I the benefits, the merits and demerits are more or same, but that skin to skin contact is only happens during the direct breastfeeding. So the bond will be increased between the mother and baby, means more interactions with the child. If we all know the mother is always busy with some and other work in the home. So when there is a breastfeeding, there is no option for her also, for baby also, and for the family members also to give her space to do the breastfeeding. Then, as we discussed, breastfeeding can save the families up to, it is in the dollar. It is actually the USA. Uh, we can say the conclusion of one researchers that $1,500 per year they can save, which they are spending on the formula feed, which is saved if we are giving the breastfeeding. If you convert into our system, now I think today's rate is 87 rupees per dollar. If you convert, it's very difficult for us to handle the formula feed. As we know, we are the developed country, but still in the remote areas, so many families are there. They are not able to reach this formula feed and these all things. But definitely, it's a God gift. We can say the problem is not observed in the rural area. The about the breastfeeding, the problem is more observed in the urban area only. Okay. Later on, I will discuss why we are facing the problem in the urban and why we are not facing the problem in the rural. Then the environmental benefits. The breast milk is a natural, renewable, sustainable resources that reduces the need for the formula feed as well as the packaging. So breastfeeding is linked with the your sustainable developmental goal number 4. Ensure the quality education and care, which is specific target for the goal 4. Yes, we are providing the good citizens with the high IQ to the society. And breastfeeding is a critical for the health of women and babies. but it also contributes to the health of the planet. Again, the eco-friendly, we are just trying to matching these objectives with the final outcome. So if you just talk about the psychological effect, yes, definitely the brain development during the infancy, especially early growth, matters a lot. So there is a myelination of the white matters as well as the CNS system when the baby is growing with the breast milk. It is heightened socio-affective responding seen in the breastfed children is possibly connected to the stimulation of the oxytocin system, and oxytocin role you all know. It is known as the love hormone, bond hormone, like that. Okay, which promotes the positive affect, good behavior, which reduces the stress, and that we can say the behavioral disorders are very less in this type of children. Okay, in mother the breastfeeding significantly reduces again the stress, which gives a more bond towards the family as well as child as well as the society. And here the again the hormone plays their role. Okay, if you see the breast milk production, the first production is important, then the ejection. So baby sucking, then sensory impulses from the nipple, then prolactin in blood. So it is more prolactin secrete in the night time. So definitely more sucking during the night time gives more milk in the daytime. Okay, secrete after the feed to produce the next feed, and it suppresses the ovulation also. Then the oxytocin reflex, which is known as the bonding hormone between the mother and baby. The first is baby sucking, then sensory impulses from the nipple. Oxytocin in blood works before or during the feed to make milk flow, and which is helping to contract the uterus also. Then breast milk transfer, then sense of accomplishment. The mother is getting that sense, okay, she is doing her 100% role, the baby is completely depend on her about the nutritional need, and that mother is doing 100% role. It gives the confidence. So these all things she can, just the sound of the baby, sight of the baby, touching the baby, so many senses are involved in this process. So the pain, worries, stress, doubts are decreased. Okay, so just with that, the common problem what we are observing in the current generation, that the feeling of not enough milk. Here one side I put a picture of cow. Even I am talking about a human breast milk, but still I put the picture because if you know, these animals are never having a complaint of no milk because they are not using their brains. They only know to love their kids. And now current generation is very, we can say, for living full of with the full of stress. They are not able to enjoy the current phases. They are always having a overthinking, and the thought might be related to the finance, related to the work load, related to the office work, related to the family's issue, and output is what, they are not getting the enough amount of milk, which is affecting the baby's health. So it is not true, it is just a perception, and the perception comes from the, it is a perception is completely psychological aspects. So in that case, how you will manage, you have to reinforce the mother, you have to increase the confidence of the mother. Frequently sucking, ensure the effective sucking. Just you all know the four signs, four correct signs, how correct attachment of the baby towards the breast. Okay, so you have to just follow. So many lactation consultants are nowadays. This become the another important profession, lactation consultant. Okay, because they are just doing, they know the technique and they are just trying to help the mother to lash the baby on the breast, become a one important profession. So there is nothing is like not enough milk. It's just a perception. Okay. So related to this, just I've shared one study that is the effectiveness of back massage on lactation among mothers having undergone a cesarean section at selected hospitals of Pune city. And the researcher concluded that at 0.05 level of significance, uh, and 218 degree of freedom indicates that the lactation significantly improved after back massage in experimental group. It is one Chinese technique, shiatsu technique. You all know we have a traditional practices. After delivery, we are doing a massage to the mother. Yes, by the some untrained people, trained people, or some Thai is there, Swede. We are using the word like Swede. They are doing the massage to the mother. With that massage only, they have to use some technique to give the some acupressure in a specific technique. So definitely the stress will release. Milk will not produce. The stress will release, and that stress release will give the outcome of adequate amount of the breast milk to the mother. Here the role is to release the stress. Automatically the lactation will improve. So breastfeeding is not just about providing the essential nutrition. It is multifaceted experience beyond transferring the nutrients. Here are the two pictures I shared with you. One picture is from the remote area. The mother is without having a knowledge and the importance of the breastfeeding and away from the social media with the lot of we can say the family responsibilities, stress and these all things. She is breastfeeding the baby. So it's a it's not a new thing for us. Okay. And another picture I shared with you, that is Alia Bhatt. We all know the story of Alia Bhatt and her daughter and these all things. She is also breastfeeding the baby. Where she is aware about all, she is having access for all the media, all the consultant and these all things. Yes. So the two means it is not that only the if you have that will, definitely that it 100% depends on the will of mother. If the mother wants to feed her baby, definitely he is able to feed the baby. If I'm not wrong, relactation is the one another aspect which I don't want to discuss here. But after the age of 3 years, 4 years also, if they want to relactate, there is a chance. Really, yes, I will. I feel bad when we are talking about the breastfeeding. Breastfeeding is not new for us. Breastfeeding is our traditional practice. Only what happened, we are fascinated with the Western culture. We are reading so much literature on that. There is no need. Just I will share this. Breastfeeding is the mother's gift to herself, her baby, as well as Earth. Yes. So the World Health Organization recommends that every mother should get a skilled support for breastfeeding. The skilled support may be her mother also, her mother-in-law also, her daughter, what we can say, her sister-in-law. Anyone can help her. Only that some support, some encouragement is required for the primary mothers who are having the first time they are having that experience. Other than there is no any separate preparation is required. Okay. So conclusion, the breast being successful, they initiate the breastfeeding as early as possible within the 1 hour of within half an hour we can say. Then do not give the baby any prelactal feeds, no bottles, artificial teats or pacifier because it will give the satiety to the baby only for the sucking, not to take a not from the psychological satiety with the feed. Then breastfeeding on demand is very important. That at least 8 to 10 times in a day. Then incorrect position matters a lot, and which builds a mother's confidence that she is having a good milk supply and alleviate the feelings of not having the enough milk. So these are the two things here I want to put. Just I'm trying to discuss that thing. Breastfeeding is not new for us. It is a traditional practice. Okay, it is mentioned in the Charak Sanhita also. It is mentioned in the Sushruta Sanhita also. And if you see the old Sanskrit literature, it is mentioned that there is one shloka on the breastfeeding, that is Ayam Kumaro Jaram Dayatu Dirghamayu Yasme Toma Stana Prapayu Varcho Yaso Balam. It means May this child by breastfeeding will live a long life with brilliance, with fame and prosperity. So this is again and again for the India, for the Indian culture, from any state of, we can say, from India, the breastfeeding is a cultural practice. We may have a different taboos about the colostrum and these all things, but it is a traditional practice. Don't go away from our traditional practices. Okay. So these are the references what I use to develop this content, and moreover, the other I can say these are the some whatever the some words and some things we took from here and there, but the origin is our own culture. Okay, is anything you want to ask?
If anyone have any doubt, please ask, madam, or you can share your questions in the chat box.
What topic I got is very simple. It is a known for all. Only you have to just justify for each and every aspects. Then definitely you will able to know the things.
Thank you, ma'am, for the excellent session with all the needed information. And now I welcome Prajakta Delvi, first year MSc Nursing student, for the case presentation. Please stop sharing the screen.
With your permission, can I leave the things
Yes,
because I
yes,
had some meetings.
yes, ma'am. Thank you so much. Thank you so
Thank
much.
you, thank you,
Thank you,
thank you.
ma'am. Hello, Prajakta.
Hello.
Will you able to share the screen?
हाँ मैम वन
हाँ.
वन सेकंड
हाँ.
Is it- हेलो हेलो
Hello.
हेलो
Yes.
विजिबल मैम
Yes, yes,
स्क्रीन
yes. It's visible.
ओके
Please
ओके
make it in slide share format.
स्लाइड
F5. Yes.
हेलो
Done, done. Good. Correct.
okay thank you ma'am giving me this opportunity. Okay, we start with my case. My case is Mrs. X, gravida 1, para 1, live 1, abortion 0, death 0, with anemia, with PIH, pregnancy induced hypertension, with post ileus day 1. Mrs. X, she is a 33 years old female. She is admitted in 6 Feb 2025, and she is came with the chief complaint of abdominal pain since last 1 days, and the diagnosis is G1P1L0 with 38 weeks and 2 days, with anemia, with PIH, and she is delivered on the same day, 6 Feb 2025, and date of discharge is 11 Feb 2025. Then she is having no any past medical history. She is having no any surgical history, and in their family no any cancer history. In antenatal history, G1P1L0, her LMP is 24/5/2024 and EDTA 21 to 2025. 4 antenatal visits she was completed. Then iron and folic acid tablets she is taken. Then patient take all the TT vaccine. Pregnancy was uneventful. but in during last trimester, she was suffering from PIH. Then in physical examination, vital sign we checked, patient BP was 140 by 90 mm of Hg, pulse 98 beat per minute, temperature 98.6 degree Fahrenheit, respiratory rate 24 breaths per minute. In general appearance, body build is moderate. She is unhealthy. Hygiene is maintained. Her weight is 65 kg and height is 151 centimeter. Then in systemic examination, CVS patient BP was 140 by 90, heartbeat is normal, ECG was normal. In a respiratory system, thorax is normal shape and symmetry, apical pulse was palpable. In abdomen, in inspection, no any redness on the incision site. On the no any sign of infection. Linea nigra is present, stria gravida is present. In auscultation, bowel sound is not heard, flatus not passed. In palpation, tenderness is present in superficial palpation. In urinary system, the color of urine is pale yellow, urine output is normal. In back and extremities, there is a lower back pain present. Range of motion of extremities is normal. There is a pitting edema present. In genitalia, presence of lochia, which is red in color. Next, next we see the investigation. The patient is anemic, so patient's hemoglobin level is 9.9 gram per DL. Rest of other investigations are normal. Then next we see the treatment and management. In drug which all are given to the patients are cefuroxime 1.5 gram BD, amikacin 500 mg BD, MSET 40 mg BD, POS 500 mg TDS, tramadol 50 mg SOS, tablet Nicardia 10 mg BD, tablet Lobet 100 mg SOS if BP raise more than 140 by 90. In management, continuous close monitoring of the patient by checking vital sign and blood pressure, then monitor for sign of any postpartum hemorrhage. Then maintain adequate hydration and electrolyte balance, prevent fluid overload. Then after LACS 6 to 8 hour, patient was NBM. Then patient is shift on liquid diet and soft solid diet. Then after all the completing all the assessment, make the nursing diagnosis. In nursing diagnosis, sorry. Pay slide. 1 minute. In nursing diagnosis, acute pain related to surgical incision as evidenced by pain scale. In subjective data, patients say that she is having pain at the site of incision. And in objective data, restless and limited mobility, fatigue. Pain score is 4 by 10. Then in short-term goal is patient will verbalize reduced pain. And in long-term goal, patient will mobilize with less discomfort. Then assess the pain of the encourage early assess the general condition of the patient to monitor vital sign. Pain score is 4 by 10 to know the general condition of the patient. Then encourage early ambulation, assist the patient in getting out of the bed, reduce the stiffness to prevent complication and promote healing. Then identify specific activity limitation. Then encourage the patient to hold the pillow over the incision when coughing or moving. Then promote non-pharmacological pain relief techniques. That is, encourage the patient to take deep breathing exercise. Then to enhance the comfort and reduce the need of the excessive medication. Then administer prescribed analgesic. Give tramadol 50 mg as per doctor's order. Help to control the pain and promote comfort and mobility. By providing all this care, after the nursing intervention, goal are met and evidence of the patient decrease in pain scale from 4 by 10 to 2/10. Next, um, prognosis and follow-up. Immediate post-operative care. Uh, Monitor the vital signs and BP, pulse, temperature, and oxygen saturation. Assist for preeclampsia, hypertension complication. Then in wound care, check for sign of infection, hematoma, or adhesions. Then pain management, provide adequate analgesic. In urine output monitoring, ensure normal kidney function. In breastfeeding, provide breastfeeding support, encourage early initiation and lactation support. In early postpartum follow-up, blood pressure is checked, then wound care, then bowel and bladder function, ensure normal urination and bowel movement. Then diet and hydration, encourage the patient to take fiber-rich diet, rich food and adequate fluid. Then psychological support, monitor for sign of postpartum depression and or anxiety. And then next prognosis after LSAS, maternal prognosis, short term, women recover well within 6 to 8 weeks. In long term, risk of adhesions, chronic pelvic pain or scar adhesions. In neonatal prognosis, baby's prognosis is good, but risk of transient tachycardia of the newborn, especially if the delivery before labor onset. Then challenges faced while giving care to the patient, that is preoperative BP control, use antihypertensive. Then preoperative PPH, active management in third stage of labor with uterotonics. Then pain management is provided to the patient. In neonatal concern, fetal distress, poor placental perfusion may cause fetal hypoxia. Then in health education, rest and activity, get adequate rest, but start walking early to prevent complication. Avoid heavy lifting for 6 weeks. Pain and incision care, take pain reliefs as prescribed. Keep the incision clean and dry. Watch for any infection sign. Then breastfeeding and nutrition, encourage for early initiation of breastfeeding within first hours if possible. Then support comfortable breastfeeding position like sideline and football to avoid the incisional pressure. Then ensure the proper latching to prevent nipple pain and improve the milk transfer. Then maintain hydration and balance diet to support the milk production. Then feed on demand at least every 2 to 3 hourly to establish the good milk supply. Then watch for the sign of adequate uh, and any sorry. Then educate on experiencing milk if direct breastfeeding is difficult. Then avoid formula feeding unless medically necessary if prevent nipple confusion. Then address common breastfeeding issues like engorgement, crackle nip, and mastitis. Then in follow-up medication, tablet folvite MB OD, then Supracal HD OD, then Ferratab OD and Nicadia 10 mg BD is advised to the patient. And follow-up, patient was asked to come for follow-up after a week with blood report. Okay, this is regarding my case. Thank you. Thank you, ma'am.
Thank you, Prajakta. Kindly fill the feedback form. The link is shared in the chat box as well as the WhatsApp group. The next section will be on Monday, 10th March, 2 p.m. on alternative feeding practices for newborn. See you all on Monday. Thank you so much.